Hi, I'm Dr. Lynch, and today we're going to talk about how we help people with disc conditions. So when we're talking about a disc condition, let's talk about that area. So this is a model of the spine here, and it's showing a section of the lumbar spine or low back where these are the bones in your spine, and these are the discs that sit in between the bones, and then these yellow nerves that come out from the side. Now these nerves, they look like it's one individual nerve, but there's actually nerves here that go out to muscles. There's nerves that carry pain fibers up to the brain, and there's information coming to and from the organs here. Now, what the discs actually do is they have three functions. First of all, they absorb shock in the spine. The other thing they do is they allow for motion between those joints. And then the final thing they do is they maintain a certain amount of space between the bone above and the bone below, because that's where the nerve comes out. If that area starts to break down and get too thin, it can press on the nerve, and that's when we have all kinds of problems that develop here. So when we're talking about disc conditions, people often talk about, do I have a slip disc? Do I have a bulging disc? Do I have a ruptured disc? There's different nomenclature, and actually it's even changed more recently, but most people talk about bulging discs. That's when the disc material starts to press out to the side, and that's when it can actually press on the nerve, as this red area is showing you right here next to that yellow nerve. That can press further out and still be considered a herniated, or what they now call an extrusion. But if the disc material actually tears, those annular fibers that go around the outside of the disc like a radial tire can tear, that's when it becomes ruptured, and the middle portion, the nucleus, can even come out and press up against the spinal cord itself. These two areas down here would be surgical situations. That's what we want to prevent. We want to prevent you from getting to that situation, because if we can catch it up here, we can really make some great improvements. Now, there's a certain way that the disc moves in health and the spine moves. So when you wake up in the morning, you're literally your tallest. During the course of the day, gravity is going to press down on our spine, and the metabolites, or the nutrients and water, come out of the disc into the joint space around it. This is an MRI that you're looking at here. And when you lay down at night, the weight of the head and shoulders and legs and hips pulls that spine apart. Those nutrients go back in, and that disc is at its fullest again, and you're at your tallest. When you have an area of the spine where it stops moving properly, that prevents that proper motion, because when that nerve gets pinched, it causes the muscles around that joint to splint or guard, meaning that it won't move. And then even when you lay down at night, that area isn't going to move properly or open, which means that over time, that joint space isn't going to get the nutrients back into it that it needs. On this MRI, what we're seeing is this white signal through here shows that there's a lot of water in that cerebrospinal fluid, or where that spinal canal is. Also, the discs have a certain amount of water that's present in them when they're healthy. But if that joint is pinched and it's not moving properly, what's going to happen is, just like you're seeing in these two dark areas down here, that disc is going to start to dry out. That's what causes those annular fibers to start to tear and come apart. That's what we want to stop and reverse, if possible, by restoring the proper motion through here. Even in the bottom of these two pictures, you can see this dark indentation into that spinal cord. That's showing how those unhealthy discs are starting to press on those nerves. Now, as I said earlier, not all of the nerves carry pain signals. And I know if you're watching this video and you've got pain from a disc, this is going to be hard to imagine, but only 10% of the nerves in your body carry pain signals up to your brain. So most of the nerves that come out of the spine are going to be motor and autonomic nerves. In other words, They go from your brain down to the rest of your body, and they run the muscles. They also get information from our organs and bring that up to the brain and help communicate that information. So if you have pain, you're going to know it, but it also has to do with the amount of activity and inflammation that's present. If you're taking it easy, if you're using your ice, you may not be feeling pain at the moment, but you may have weakness, spasms, fatigue, or tightness from pressure on those nerves that carry motor information. Or if it's nerves that go out to the organs, or visceral or autonomic nerves, those autonomic nerves could give you sinus or allergy symptoms. You could have low energy, you could have fatigue, you could have digestive or breathing problems, and most people always report poor sleep from these types of conditions. In my office, my approach to this is doing a consultation with you to find out what your history is. How long have you had this condition? Have you had it more than once? What activities do you want to keep doing? Because in my office, the goal is not to prevent you from doing things, but to get you back to doing all the things that you love and need to do. After that, we do an examination. In our office, we do orthopedic and neurological tests. We're testing the sensory nerves. We're testing the motor nerves. We're trying to find out exactly where the problems are so that we can correct them. That MRI I showed you is a fantastic picture, but one of the things that happens is when you do an MRI, at least in Central Virginia, you're doing that laying down flat. Now, the spine is a weight-bearing structure. Most people, when they wake up in the morning with a disc condition, they have some stiffness, but it actually gets worse as the day progresses because they're bearing weight on that spine, and those discs are getting loaded with more and more during the course of the day. So we take weight-bearing x-rays so that we can see what's happening with you standing, so we know what's happening with those discs. Once we find out where the problems are and what needs to be done to correct it, we do instrument adjusting. So I have an adjusting instrument that glides up and down the spine, and it restores the curvatures to the spine. As it does that, we can also use that instrument to press that disc back underneath the spine so that it's not pressing on the nerve root anymore. This is the back of your spine with these bony locks. There's nothing you can do back here that's going to correct around front. You've got to come at that obliquely or at an angle with an adjusting instrument to gently put that disc back into position. When we do, we'll know it because we already did the motor testing from the orthopedic test to know where the weakness was, and we'll see that strength getting restored 30 to 50% following the very first treatment. We're going to know that what we're doing is working or is not working. Next thing we do is we use cold laser. Cold laser is an awesome tool that helps heal soft tissue. We've been using it successfully in our office since 2007. It's a great tool to help turn on those nerves, decrease the inflammation, and improve motor strength. And by restoring strength around those spinal segments as we're helping them heal, that's going to help you get better so much faster. Another tool that we use in our office feels like a massaging tool. It's called a percussion instrument, and what it does is it releases fascia adhesions. So around the covering of your muscles you have fascia. Fascia is a glycoprotein or a sugar protein. Over time, instead of separating the muscle bundles and allowing them to slip and slide over each other, that fascia or glycoprotein breaks down and it starts to stick together and adhere. That creates scar tissue adhesions, preventing proper motion and not allowing the spine to go back to its proper position. We use that instrument to help restore that function and motion back to the spine. It makes a huge difference. The adjusting instrument and the percussion instrument, most patients say it feels fantastic. It's very gentle. It feels good when you're getting the treatment done. Now, this is in contrast to most of the other treatments you've either heard of or tried. So, typical medical treatments would be stretching and strengthening around that joint. Can be helpful, but once again, we're not restoring that disc back to its proper position. it's going to continue to break down, and it increases the likelihood that it's eventually going to tear and become a surgical situation. Pain medications or injections will help reduce your pain. However, they will not restore the disc back to its proper position, and you're going to have further breakdown in those areas. Radio frequency, or an ablation as they call it, is where they actually burn the nerve. I know that may sound crazy, but they're going to actually burn the outside of this nerve right here, because just like a wire, it carries that pain information up to the brain, and it can help stop that. In 6 to 12 months, your body is going to heal that scar or scab across that nerve, and those symptoms frequently come back. And because we haven't corrected the underlying condition of the disc misalignment, usually the condition's going to be worse. Finally, there's surgery. Now, don't expect your surgeon to tell you you're going to get back to golfing or skiing or playing with your grandkids afterwards, because once they cut that disc, it's going to be weaker, not stronger. So try to avoid surgery at all costs. Put it as your last potential option. What we do here is a great option. I've been helping people with disc conditions since 2007 get better in this office. My name's Dr. Keith Lynch. I look forward to helping you.